Think about the last time you had a minor procedure. Maybe a tooth pulled, maybe stitches, maybe just a needle in your arm. You were nervous, maybe scared, but you knew it would be over quickly. You knew you wouldn't feel much. Now imagine that same procedure, but there's no anesthesia, no sedation, no numbing agent of any kind. Just you, a table, 4 men holding you down, and a surgeon with a saw. And the faster he moves, the better your chances of surviving. That was medicine for most of human history. Not 100 years ago, not in the Dark Ages, within the living memory of your great-great-grandparents. And the man who finally ended it, the man who gave the world the gift of painless surgery, died broke, disgraced, and convinced he'd been robbed of everything he deserved. I'm Aidan Thomas, and this is the hidden history of anesthesia. The year is 3000 BC, ancient Egypt. A scribe is pressing a reed stylus into wet clay, recording something that will not be read again for nearly 5,000 years. It is a surgical manual. The Edwin Smith Papyrus, discovered in Luxor in 1862, is the oldest known surgical document in human history. It describes 48 cases, fractures, wounds, tumors, and for each case, a recommended procedure. What it does not describe is how to stop the pain, because they had no answer for that. What the Egyptians did have was mandrake root, a plant that causes hallucinations and drowsiness when eaten. They soaked it in wine and gave it to patients before cutting. Did it work? Partially. Did it stop the pain? Absolutely not. But it gave the patient something to do with their mind while their body was violated. But here's where it gets interesting. They weren't just doing minor procedures. The Edwin Smith Papyrus describes brain surgery, skull surgeries, the removal of infected tissue from the head, and the survival rates, based on skeletal evidence, suggest some of these patients actually lived. People in ancient Egypt survived brain surgery without anesthesia, without antibiotics, without anything we'd recognize as medicine today. Let that sink in for a moment. The oldest surgical procedure we know of isn't brain surgery, though. It's trepanation, the practice of drilling or scraping a hole into a living human skull. Archaeologists have found trepaned skulls on every inhabited continent on Earth, from Peru to France to Kenya, dating back over 10,000 years. 10,000 years! Some of these skulls show healed bone around the hole, meaning the patient didn't just survive the operation, they lived for years afterward. Why did they do it? Theories range from releasing evil spirits, to treating epilepsy, to relieving pressure from head injuries. But here's the detail that stops people cold. Many of the holes were not made with one cut. They were made gradually, incrementally, over what must have been hours. Which means someone was awake, conscious, and held down while another person slowly scraped through their skull. And they survived. The ancient world's answer to pain management was essentially endure it or die. Opium poppies were cultivated in Mesopotamia as far back as 3400 BC, not primarily as a painkiller, but as a recreational drug. The Sumerians called it hul-gil, the joy plant. At some point, someone noticed it also dulled pain, and for the next 5,000 years, that discovery, opium, would be the most sophisticated painkiller available to surgeons anywhere on Earth. Think about that. From 3400 BC to the 1840s, a span of over 5,000 years, humanity made essentially zero progress in surgical pain management. Zero. The best tool a surgeon in 1840 had for stopping pain was the same tool a Sumerian farmer discovered by accident planting poppies. But the surgeons of history weren't waiting around for a solution. They adapted. And the way they adapted is one of the most disturbing stories in all of medicine. Speed became the primary surgical virtue, not skill, not knowledge, speed. In the era before anesthesia, the fastest surgeons were considered the best surgeons. Robert Liston, a Scottish surgeon practicing in London in the 1830s, was the undisputed champion. He could amputate a leg, cut through flesh, saw through bone, tie off the major blood vessels in under 2.5 minutes. Crowds came to watch him work. He operated in front of a packed gallery, students and physicians leaning over the railings, pocket watches in hand.
A packed gallery. Surgery was a spectator sport. Because patients couldn't be under anesthesia, they were conscious, screaming, fighting, begging, and the speed with which the surgeon moved was the only mercy available to them. Liston was so fast that in one famous or infamous operation, he accidentally amputated his assistant's fingers along with the patient's leg. Both the patient and the assistant died of infection afterward. In his rush, he also slashed through a bystander's coat. The bystander, seeing the blood, assumed he had been stabbed. He dropped dead of shock. One operation, 3 fatalities. This is the only surgery in recorded history documented to have a 300% mortality rate. You just can't make this stuff up. Before operations, patients were given options. Alcohol was common, not enough to stop pain, but enough to dull the edges. Laudanum, a tincture of opium dissolved in alcohol, was standard. Some surgeons applied ice to numb the surface tissue. Some used a technique called compression, pressing hard on nerve bundles above the surgical site to partially deaden the limb. Others used hypnosis, actual hypnosis. A Scottish surgeon named James Esdale performed over 300 operations in India in the 1840s using nothing but hypnotic suggestion. His mortality rate was significantly lower than his peers. The British medical establishment called his results fabricated. They would rather believe a man was lying than accept that their entire model of surgery was wrong. This is where the story gets darker. Because the operating theater, and they did call it that, was designed for observation, not for the patient's comfort. The theaters were tiered, with rows of seats climbing upward from the central operating table. The table was wooden, permanently stained. The surgeons didn't wash their hands, not because they were careless, but because the germ theory of disease hadn't been proven yet. They believed disease came from bad air, not from contaminated instruments. Surgeons wore their oldest coats to operate, not clean ones, old ones. A coat thick with dried blood was a badge of experience. The more blood on your coat, the more operations you'd performed. A clean coat meant you were a novice. The most respected surgeons in Europe wore what were effectively biohazard uniforms to work every day and considered it a point of professional pride. The smell alone was reportedly unbearable. Witnesses described the operating theaters as smelling of rot, blood, and something they could not name but never forgot. Patients were strapped down or held by 4 strong men, often medical students. The screaming was unavoidable. Medical students were trained to ignore it. Some never could. And then everything changed, not gradually, not through decades of careful research, in a single afternoon, in a single demonstration, in a single room in Boston, Massachusetts. October 16, 1846, Massachusetts General Hospital. A dentist named William Morton has convinced the hospital's chief of surgery, John Collins Warren, to let him demonstrate something. Morton has been experimenting with sulfuric ether, a volatile chemical compound which, when inhaled, renders a person unconscious. He has used it on a patient during a tooth extraction. He believes it will work in surgery. Warren is skeptical. The gallery is packed. Students, physicians, observers, they have all seen demonstrations fail before. A man named Gilbert Abbott is laid on the operating table. He has a vascular tumor on his neck. Warren looks at the clock. Morton is late. The audience grows restless. Warren turns to the gallery and says, as only a Boston patrician can, "Presume, gentlemen, that we are ready to begin." Morton arrives at the last minute. He places an inhaler, a glass globe with a tube attached, filled with ether-soaked sponge, over Abbott's face. Abbott breathes, and then he goes still. Warren steps forward. He cuts into the neck. Abbott does not scream. Abbott does not move. Abbott does not even flinch. The gallery is silent, completely silent. Warren turns to the audience. He is a man not known for sentiment. He has spent 40 years cutting into conscious, screaming human beings because there was no other option. And he says, "Gentlemen, this is no humbug." Within weeks, the news had spread across the Atlantic by ship. Within months, ether was being used in hospitals across Europe. Within a year, a Scottish obstetrician named James Young Simpson had discovered chloroform, easier to administer, faster to take effect, and more powerful than ether. The medical establishment had its solution. Surgery would never be the same.
But here's the part of the story that most people never hear. William Morton was not the first person to discover surgical anesthesia. He wasn't even the second. A physician in rural Georgia named Crawford Long had used ether to remove a tumor from a patient's neck in March 1842, 4.5 years before Morton's famous demonstration. Long simply hadn't published his findings. He kept using it quietly in his practice with his rural patients, not realizing what he was sitting on. And a dentist named Horace Wells had demonstrated nitrous oxide, laughing gas, as a dental anesthetic in January 1845. He arranged a public demonstration at Massachusetts General Hospital, the same institution where Morton would triumph a year later. The patient cried out during the procedure. The audience jeered. Wells was called a fraud and a humbug and escorted from the hospital in humiliation. He never recovered. He became obsessed with anesthesia, experimenting on himself with increasingly dangerous compounds. He became addicted to chloroform. In 1848, while under its influence, he threw acid at 2 strangers on a street in New York City. He was arrested and imprisoned at the Tombs jail. He came to his senses in his cell, was horrified by what he'd done, wrote letters of apology, and took his own life. He was 33 years old. 3 months later, the Paris Medical Society declared Horace Wells the true discoverer of anesthesia. He never knew. And William Morton, the man who did get the credit, the man whose demonstration actually changed medicine, he spent the rest of his life in legal battles, fighting for patent rights over ether. He sued the government, he sued hospitals, he sued colleagues. He died in 1868 at 59, financially ruined, exhausted, and bitter. The discovery that liberated millions of patients from unimaginable pain destroyed the man who proved it worked. Sound familiar? The establishment didn't surrender easily either. There were surgeons who argued, in print, in academic journals, to other physicians, that pain during surgery was actually beneficial, that it stimulated the patient, that it kept them alert and fighting, that removing pain would lead to worse outcomes. One prominent London surgeon wrote that the sensation of pain was a powerful stimulant and that patients who felt nothing might simply give up and die. They were defending a worldview, not a science, because accepting anesthesia meant accepting that everything they had done before, every conscious patient, every screaming body, every operation they had justified by saying there's no other way, could have been done differently, that the suffering wasn't necessary, that they had inflicted it anyway. That is a very difficult thing to accept about yourself. But the evidence was impossible to argue with. Operating times, which had been minimized to reduce pain, could now be extended, allowing more careful, thorough procedures. Survival rates began to rise. Surgeries that had been considered too complex, too time-consuming, too cruel to attempt became routine. The entire field of abdominal surgery, removing appendices, treating internal injuries, operating on organs, became possible only because of anesthesia. Without it, you simply could not keep a conscious patient still long enough to work inside their body. Within 20 years of Morton's demonstration, surgery had been transformed more completely than in the previous 5,000 years. The speed surgeons of the pre-anesthesia era, men like Liston, became curiosities, relics. The skills they'd spent decades perfecting, cutting fast, ignoring screaming, managing a fighting patient, became irrelevant almost overnight. But here's the dark twist that nobody talks about. Anesthesia solved one problem and revealed another. Now that surgeons had time to work carefully inside the body, their patients started dying of something new. Not from shock, not from pain, from infection. Post-operative infection rates were catastrophic. Nearly half of all patients who underwent major surgery died in the weeks following their procedure, not on the table, in their beds of raging fever as wounds turned septic.
Anesthesia had made surgery survivable. Infection made it lethal anyway. It would take Joseph Lister, working in Glasgow in the 1860s, building on Louis Pasteur's germ theory, to solve that problem. Lister began using carbolic acid as a surgical disinfectant. He soaked instruments in it, sprayed it in the air during operations, used it to clean wounds. The results were dramatic. Infection rates collapsed. The surgical death rate fell from nearly 50% to single digits. Surgery had two revolutions in 20 years: anesthesia in 1846, antisepsis in 1867. Together, they created the operating room as we know it today. Think about that the next time you go under general anesthesia. The anesthesiologist places a mask over your face. You count backward from 10. You wake up an hour later, groggy and confused, and the first thing you feel is mild nausea, not screaming agony. That transition from 4 men holding you down while a surgeon amputated your leg in 90 seconds to drifting peacefully into unconsciousness took less than a generation to achieve. And it happened because of a dentist who arrived late to the most important appointment of his life, a rural Georgia doctor who never told anyone, a disgraced man who died in a jail cell and was vindicated 3 months after he was buried, and a medical establishment that needed 20 years to admit that the screaming had never been necessary. Anesthesia didn't just change surgery, it changed what it meant to be a patient. It changed the relationship between doctors and the people they treated. For the first time in human history, medicine didn't have to hurt to work. For the first time, a person could go to sleep and trust that they would wake up without having lived through something that would haunt them for the rest of their lives. From a Sumerian farmer discovering the poppy in 3400 BC to a glass globe filled with ether on a wooden table in Boston in 1846, from surgical theaters where the screaming never stopped to the quiet, humming operating rooms of today, where the greatest challenge is convincing patients not to be scared. Every operation has a hidden history, and sometimes the most ordinary moment, lying back in a hospital chair and closing your eyes, carries 5,000 years of human suffering inside it. If you found this history as extraordinary as I did, hit the subscribe button and the like button below, and comment down below any other hidden histories you want us to uncover. Next week, we're going somewhere even darker, because if surgery without anesthesia sounds terrifying, wait until you find out what happened when you got a toothache before the drill was invented. The hidden history of the dentist. You have been warned.